Hi guys, how's everyone out there? Hopefully everyone's logged online and we all got our tech ready to go and you're ready to go. So I'm going to do today on a plinth, so we're going to be working on our low back. So anyone out there that's online now, can you give me a like, a love, a thumbs up? What's that new one, the care? Have we got a check on everyone's tech? They can hear me okay. Hope you can hear me okay. Give me a thumbs up or a love if you can hear me. That's brilliant. Excellent. Right, so what we're going to do is we're going to do a session on our hips and spine. So when we do our hips and spine, we're going to sort of free them up. If you're feeling pain or you actually have an injury or actually have a problem, then make sure you don't do it. And you've got to make sure that you contact us directly, DM us or old school call us or even email us to make sure you get the appropriate advice. For everyone else, this is the mobility exercises for your hips and your low back. We're going to go into your mid back as well. So the first one to do is glutei. So anyone that has sort of back stiffness, this is for you, but if you're getting pain, then it's probably not for you. So we're going to work on the glutei. So these muscles here in the rump of the buttock, so the glutei and the hip intrinsics, and so the best place to do that is laying down. You can do things sitting, but we're going to just kind of make it easy and do it laying down. People might have noticed the best way of doing things, of getting up and down when they've been bad with their back, is to get up and down in a sort of seesaw fashion. So in this position here, and let yourself rock down and let your knees come up, and in this position then we roll onto our back. So, head supported by a pillow, and that will make you nice and comfy. And what we're going to do is going to stretch the glutei out. So a foam roller, a bed, somewhere with a fluffy carpet. I wouldn't do it on hard floor because that would just hurt your spine. So everyone in that sort of position now. So if you're all ready to go, so thumbs up, like, love, and make sure that you comment that you've got low back stiffness and this is for you. So comment below. Right, so we're going to drop our one leg down straight, and then we're going to bring your knee up and across to the opposite armpit. So as you do that, the idea is to bring your right knee, to your left armpit, and that will stretch this buttock muscle here, the glutei. It's a fan muscle, sort of. There's lots of muscles in here all combined together, and we're just trying to get a whole stretch through the whole area. So you bring in your left elbow down towards your left side to pull that in nice and hard, and you'll feel a nice stretch, making sure your head's supported, and keep your rest of your spine straight and relaxed, and get the stretch in here, and do that for about 15 seconds. And as you feel that pulling, that's great. And then you're just trying to stretch and improve, not just going to sit there comfortably, stretch and improve. And then we get around to 15 seconds, then you're going to drop that down, swap the legs round, drop this one down, bring this right knee up, again this elbow down and in towards our side, bringing our knee towards our opposite armpit. So you'll feel a nice strong pull into the hips. So make sure that you get that timing: 7,000, 8,000, 9,000, 10,000, 11,000, 12,000, 13,000, 14,000, 15,000. You feel a nice strong stretch into the hips. So an alteration of that is, if you feel any groin pain when you're doing that, that's a sign that you might have a problem in your hip, the capsule, the joint. It might be wear, you might have an SI problem. So we can alter that slightly by bringing our hand down onto the side of your leg and bringing it up and across. So you can feel that going across that angle there. If you feel like this one works better for you, that's fine. Some people will feel like this works. As long as you don't feel any buckling feeling inside the knee itself, that's fine. And feel that strong pull. Great. And you're holding and improving, and drop that one down, and then lift it up and across. And so again, that altered one or the straightforward one, whichever one you feel is feeling the strongest. Bringing that arm down and in, not out wide. You feel a strong pull in the hip. What we don't want to feel is that nipping in the groin. Keep pulling across. Good. And that's two. Yeah, it's good. Keep going. That's great. And you feel that nice strong stretch. Drop that down. Now if you do feel a groin pain still in that position, you can change it again. So you can bring it right up, supporting your knee, protecting your knee, making sure you don't feel the knee hurt or nipping in the groin, and then bringing it up, straight up, so you can feel a stretch in the hip, up high, nice and strong. Keep pulling, keep pulling, keep pulling. And that's nice and firm. And as you feel that pulling and relaxing, you keep going, keep chasing, keep chasing. And it's plateauing out. That's great. And then drop that one down. And the same on the other side. If you're feeling any sharp pain in the groin, stop what you're doing, DM me, message me, ask me some advice. or I like to call it old school call me, and bringing that up and across. So we're doing this 15 seconds 3 times. And if you want to have a long-term problem, you have a long-term problem in your hips, then you want to repeat this 3 sets a day over a longer period of time. Again, this is not why your hips are tight. This is just freeing your hips up. So often it's overlooked at why hips are tight. We're just going to stretch it, keep pulling that in. Good. So any hip pain, stop what you're doing. So that's freed up the hips, the top section of the hips. Now, because it's a fan muscle, we can do another one. So getting one leg down. This is slightly harder, bringing the knee further across. Now, this may well cause, again, that nipping in the front of the joint, the hip or the SI joint can moan. Bring that one straight across, bringing that elbow down and in, and you feel a strong stretch on that hip. And this is more of the lateral part of the hips, more pulled here. Now, sometimes you might feel that dropping just below that 90-degree line is better. What you don't want to see is that rolling of the spine, because all you're doing is stretching the spine. We're trying to focus on the hip and bringing that elbow down and in. And then same on the other side, bringing that one straight across. And you feel, again, strong stretch through the side of your hip here. And nice firm pulling. So nice firm stretch through the side here. Now, if you feel like it's freeing up, you're going to just keep chasing it. And around that 15-second mark, as it starts to loosen, you feel it loosen, loosen, loosen. And then just back it off. And so go back in the second set, up and across. So I'm just trying to feel where that's tighter, below 90, 90, slightly above 90 for me, and bringing that elbow down and in. I'm not getting any groin symptoms, feeling a strong stretch. That's fantastic. Nice strong pull. And just keep working on that, down and in with that elbow. And this will really free your hips up very well. Again, I will say it again, it doesn't mean why your hips are tight. Everyone that comes to see me, I know the why is the most important. Just freeing muscles off without understanding the why is no good to anybody. You need to understand why your hips are tight. Good, and then drop that one off. And again, same on this right side. Again, same thing for me, is slightly below. I find just above 90 is good for me. Into here. And you feel that stretch and keep chasing it. So it's 15 seconds, keep going and chasing it so you feel that nice strong pull. Good. And you'll feel as you're going through second set of stretching and third set, you'll feel it improve. If you feel like you're getting some more out of it, there's no harm in doing an extra set of a third set, going from third to a fourth set. But the statistics are that it doesn't make as much effect when you go on and do more sets past 3. And then drop that down and then going across. I did have a lovely lady many years ago that was doing exercises, and I used to say, you can't do it too much, you can't do it too much. No, you can do it too much. She was doing it about 20 times a day, came back very, very sore. That's a learning lesson for a young osteopath. So make sure you're sensible, 3 sets a day or 4 maximum. I wouldn't do anything more than that. Good, and keep pulling and stretching. And that's great. And then loosen that off. So when we get up, we've loosened our hips, so we've got to be careful that we don't push ourselves, and our back might be a bit vulnerable because you've got back and hips are very closely associated. So make sure you get up nice and sensibly. Get up on your side if you're off a bed, or if you're off the floor, roll onto your front. So off the side here, I'm rocking up. So that's the hips freed up a bit. So we're going to go and do some low back work now. So we're going to do some rocking and rolling is what I call it, rock and roll. So don't worry, I can hear you're all panicking out there that I'm going to start doing rock and roll. I said not even my kids like to see that. I love dancing in front of my kids. One of my favourite pastimes is embarrassing my children, as they well know. So, but this is an exercise to mobilise your back called, I like to call it rocking and rolling because people can remember it really easily. So it's a rocking exercise and it's a rolling exercise. Bit different from a lot of other exercises we do. This is about mobilisation of the joints. It's about pumping out inflammation. It's not so much about working on the muscles themselves. This is ideal for people that suffer from morning stiffness. If you don't know why, you've got to type in why down below in the comments, because if you don't know why, you need to find out why. Why is your back inflamed overnight? Why is it getting stiff? If you get stiff in the morning, that means inflammation's built up overnight. It means you've injured it in the day before, and you need to understand why that chronic inflammation is occurring and then treat those underlying causes, not just inflammation in your back. But these exercises are great to get you out of a hole if you're acute. So here we go again, laying back down again, rocking like this onto your back. Now, if you do find yourself acute, these exercises are quite good to get you mobile, but they should only be used when we've directed you to. So knees bent, one leg up at a time, other leg up, interlace your fingers together, and then you're going to rock your knees up to your chest. Now make sure your head's supported by a pillow. And this is the rocking part of the rock and roll. So if you're enjoying your rocking, you're probably going to struggle to get to your phone to put rocking, but to put in rock and roll. Everyone fancies a rock and roll soon. I bet everyone wants to go out partying. So you're just feeling gentle rocking exercise there. And so if you're feeling any abject pain, some sharp pain, you should stop what you're doing. If you're feeling just a nice gentle stretch at the base of your back, that's brilliant. What we want to see is a nice gentle tugging and traction of those joints at the base of your back apart, and calming down those joints and pumping like a bilge pump, pumping the fluid out from the base of your back. And this will be a really good one to get yourself mobile, to get that inflammation out of your low back. If you feel any pain, what you're doing, stop what you're doing. What you should feel is the stiffness slowly start to improve. And as it does, you start to rock up a bit higher. So keep going up a bit higher, and you'll feel it just mobilise as you go. And that mobilising, feel that stretching in the base of your back. And this stops when you feel like it's not making any improvement. So what we don't want to see is fast jabbing movement. You can do it where you just stretch and hold to start with. The only thing is that doesn't help so much with inflammation. So you can just stretch and hold. Some people like to roll their head up. It does put a lot of strain down your back. So I would say just do this to start with. And then if you want to reinforce it when you feel a bit more confident and you're sort of not feeling stiff, you can roll up into a ball. I just like to just do the nice sensible steady one like this. And then if you do feel a bit more mobile, then you can do it a bit stronger. So, and then as you do that, that would take about between 30 seconds and 3 minutes classically, I would say. But for most people, you'll probably be around about a minute of this by the time you get to the top and you're feeling like, I'm not feeling like there's too much stiffness left in my back. So if you get up quite high and then you just kind of feel it kind of like there, and you can feel that kind of actually not a lot left now. So that feels quite nice and loose. So as you've loosened it up really well, we need to be careful we don't just dump our legs down, because if your back's feeling fragile, that can just make your back spasm. So let your legs drop down separately to keep it calm. If at any time I've given you this advice in the clinic, one the osteopath has, then make sure you bring them up separately to start with and bring them down separately, because it induces a muscle spasm if you drop them down really fast. You've just loosened them off. The last thing you want to do is go whoop and snap them back down again. You'll regret it. You'll only ever do it once, trust me. So then laying on your side and then you get up again. But I would actually say I would normally put these two together. So I would then do I've done the rocking. Obviously now we're doing the rolling. So in this position again, head supported by a pillow, in this position, and then rolling from side to side. So when we were doing the hip stretching earlier, we were doing this exercise where you do this and then it was doing the hip, and a lot of people then just roll into their back. That's an extension of this exercise, so you can just roll from side to side, trying to keep your spine as flat as possible. And what we don't want to feel is any sharp jabs of pain. Sharp jabs of pain, pain's bad. Comment pain below and DM me, call me, email me, get a bit of advice. But this exercise shouldn't really cause any pain. You should feel a gentle stretch on the lateral part, the outside, the flank of your back, and it will just keep mobile. What you shouldn't do is let your spine rock with it. So you're just trying to keep your upper spine down and the lower spine rolling from side to side. So try and keep those shoulder blades pinned as you go from side to side. And you feel it kind of mobilise. The end of the exercise, similar to the rocking, the rolling is all about mobility. And what you'll find is you'll make your way down as you do it. So reposition again, rolling side to side. And you'll feel eventually, after about 45 seconds, a minute, that the exercise comes to a natural end because you don't really feel too much more stretching. If it plateaus and it's really tight still, then probably means that there's something really tight and there's something going on in your back that needs to that's holding on for a different reason. And again, you should give us an email or DM us for ask some bit of advice. Right, brilliant. So, laying on your side here, then drop your legs down and up. It's important to rock up again, because if we've loosened our back up, and we've loosened it up really well, and the back's going to be feeling slightly protective, it can just tighten back up again if your back's a bit fragile. So make sure you rock back up and go steady for about a few minutes just to get your back mobile. Walking around the room just loosens it up. It will feel much more comfortable afterwards. So we've done our hips and back. Now we're going to go into our mid back. Now there's some more gentle exercises you can do. I'll show you a bit of a couple of bits for you to do, to maybe do a bit later. I'll show you these now, but I'm not going to focus on these. So doing more gentle ones. Depressing, I've got my golf club here, it's a very old one here. So what we do is we use it across here. We can use a broom handle, golf club, hockey stick, whatever you fancy, across here, and then we're in this position and we just rotate on each side. What we don't want to see is our legs buckle as we go like this. So we don't want to see our legs buckling. What we want to see is it nice and firm across our hips, and then just going to rotate. Good golfers will know this one. What we don't want to see is our spine or hips twist and lose its angle. So we're going to keep our angle the same. Keep that rotation through both sides. And then the other one is through here. Same thing again. You don't need to do it with a golf club. You can do the same thing just into here and then rotating. Slightly harder, holding your front ribs instead here, keeping your hips and knees flexed and rotating. And you can do the same thing here, just rotating, and it does the same thing. So you're using that spine to rotate as you do that. Brilliant. So as you're doing this, that will just get the whole area mobile. You can do that for a lot longer. It's quite gentle. Most people will be able to do it. Everyone knows me, I like the hardcore stuff. So you can use if you've got a towel around, a bath sheet or something you can roll up. You can roll it up very gently, or you can roll it up really tight. I'm obviously going to do it really tight. So we're going to roll that really strongly. Didn't tell anyone to prep with a towel, so you might be scrabbling around for a towel right now, so sorry guys about that. I've really got to organise myself a bit more. So we're going to use that. What you can use is a rubber band, if you can use that in there. I mean, I don't, because we just use it temporarily, but if you're going to use this over a period of time, put a rubber band around it. In this position here, and we're going to do it in 3 sections, bottom, middle and top. It's just going to biscuit break open the whole area. Now, if you suffer with stiffness in the area, this one's for you. If you're over 60, osteoporosis, spinal instability, spondylolisthesis, any reasons why you've got a weakness in your spine, there's hundreds of reasons why you wouldn't do this. So if you have any doubt at all, this is definitely not for you. So everyone else that's got a great spine that's just a bit stiff and needs a bit of mobility, then we're going to carry on. But everybody else, then message me if you're not sure, because I can give you a bit more specific advice. So message not sure, and then we can get in contact. Right, so we're going to do that. What you can do is either lay it down, I generally lay it down and hold it in that place, and then I'm just going to put my back on top of it, just above my rib line. So just above the lady's waist. For blokes, it's just on your lowest ribs. In that position there, head supported by a pillow and arms above your head, hold in there, and you'll just feel it opening up those joints. So if you lay there for a while, the lazy man's exercise this is, laying down. Everyone loves this one, laying down, do nothing. And you're going to take a couple of gentle breaths in and out. And you'll just feel your back relaxing over the top of it. If it's too strong, make the towel smaller. If it's too strong, make the towel looser. If it's not strong enough, make a bigger towel. And if it's not strong enough, make it even tighter. So you can use this as you see fit. A hand towel is smaller than a towel, and then a bath sheet's bigger again. So you can use it as you want to. I would say just a normal towel will be fine to start with. And I can feel that as you breathe it out. And as you breathe out, you might well start feeling some tension around your diaphragm here, the lower ribs, because that part of your spine has the diaphragm attachments coming around from the back. So breathing in and out really helps loosen the whole area up. And most people find it quite relaxing to breathe properly anyway, and try and breathe from your tummy, not from your chest. Even if your tummy is getting a bit bigger like mine is at the moment. That's good. And then as you do that, I would roll off that gently, because it's a very strong exercise. And then we're just going to roll it up a little bit higher. So we're going to hit that mid part of our back now, and say lay back down on top of it. And head supported again. Now you'll feel a lot less pressure through here because these ribs come around to the front just into this area here. Now a lot of people suffer from mid-back stiffness, and this can be a very effective treatment for people. So if you're suffering with mid-back stiffness, type in mid-back, or if you're clever, TSP, thoracic spine. And that's just a way of just freeing up those muscles and joints. Again, it doesn't explain why your back's stiff. And if you don't understand why your back's stiff, then actually this can be a bit not that helpful, because you're just going to try and free up joints that you don't understand why they're stiff. So we need to understand why your thoracic spine is stiff. Is there something else going on somewhere else that needs to be looked at? And so you're just laying there for sort of somewhere between 45 minutes and 1.5 minutes until you feel like every time you're taking a breath, and you can feel that kind of tension come round. It's not really feeling like it's improving very much. So, going to go up and go up a bit higher again. This one's around about over your shoulder blade area. Now, this is the most common area most people get mid-back stiffness. This may well help, but often mid-back problems that high up could be around ergonomics, shoulder positions, rounded shoulders, poor posture, lots of other reasons. So again, you know, this can be useful, but it's not a long-term solution. So this is the last one up the top. And then if you find that you're laying there and you're quite comfortable, so that I feel like it's fairly strong, so I'm doing that. You can fiddle around with your arms. If you put your arms down, you'll feel that it won't work. So putting your arms up, and I can feel my shoulder blades are really resisting that slightly. So try and let your shoulder blades drop as flat as I can. And then breathe in and out nice and gently. Now, if you're feeling extra mean, you can put the towel down, put the pillow down, and let your head drop onto your hands. And that will just give you an extra bit of leverage that will get into your upper back, and that will make it a lot stronger. You can do that lower down, but you'll find it much more effective doing it higher up in your mid-back, in your thoracic spine. And then keep that breathing going. It's a shame all exercises weren't as easy as this one. Good, and you can feel that nice and free. Good, and keep breathing. And as you breathe out, you're trying to relax into it. And breathe into it, good. Lovely, okay. So those are 3 sections in our back, coming off that nice and gently. Now make sure you only do that if it's appropriate for you. Some of those exercises are very strong. They're certainly not for everybody, and if you're not sure, you should message us. Those have got a lot of strength in those. The ones standing with a golf club are very useful. They're great to warm up if you're going to do exercise. These ones are a bit more powerful to be done at home. Make sure you've got the towel and you've got yourself set up that you don't go too strong too quickly. Loose the towel at the start and then tighten it up, make the towel tighter and then make the towel bigger. I mean, that's a hell of a lot of fun. I actually really enjoy these exercise groups that I'm doing, these stretching and mobility exercises. It's a lot of fun having a good banter with my patients, taking a mickey with me. I'm not doing as many jokes as I usually do in clinic. I tried to do a little bit more of our jokes, rocking and rolling. They are shocking jokes in the clinic, and I do apologise for them. But they do make me laugh, regardless of if they make my patients laugh. So hopefully my patients have good fun. Hopefully you guys had fun as well. If you have any problems, then obviously direct messages or get in contact. Everyone, for next week we'll be going up into your upper back and thoracic spine, from in there into your shoulders. So we're going to be doing shoulder work next week, and that will be a good strong one with stretching and foam roller. Everybody else, if you want to stick around for a foam rolling session, what you're going to do is you're going to start at 1/2 past, so it's about 7 minutes time. We're going to get a foam rolling session. Everyone that hasn't got a foam roller, get yourself a foam roller, and we'll see you in the double session next week. Otherwise, have a good week, and I'll see you next time. Take care. See you in a few minutes, guys.